Okay, we just hopped over to the other one. Okay, so sorry, everyone. Okay. I don't know why, but in my Zoom account, that one wasn't coming up. I literally had to copy and paste the meeting code, so I apologize. I don't know, but I will certainly get that fixed. And this is one of the many reasons why we could really use a second.
Can anybody see me or hear me?
Yes to both.
Yay! Hi there.
I'm going to copy the link for the agenda and put it in the chat right now.
I did get it from Michael, but go ahead just for anybody else.
Thank you.
Okay.
Here's the agenda.
At least I see the three of us.
Joe, hopefully you see more than that. There's a bunch of us.
Oh, okay. Hello, everybody's on here.
Okay, I apologize greatly for the two different Zoom links. I promise I will get that fixed. Yeah. Also, we're still looking for a secretary. I need to diploma. Okay, let's see. Do we have everybody on? Oh, here's Rick coming in.
Board members, I just would like to remind you to turn on your cameras so that we can always maintain a quorum of members visible.
Wait, I thought mine was on. Switch.
Yours is, Joe. You're good.
Oh,
You're
okay.
All right, we're going to go ahead and get started because now it's 2:42 and I greatly apologize. And so we'll call the meeting to order here at 2:42. And we're going to go ahead and start with introduction and roll call. So I'm Chair Kat Odell. Good to be here tonight. Do we have Vice Chair Michael?
I'm here.
All right, excellent.
Yeah, Vice Chair, if you could turn on your camera, it would help us maintain quorum. Thank you.
But I'm also in the room. I don't know why the owl's not picking up on me.
Oh,
But-
and then great. And then if you're in the room, Chair, if you're remote, please note anyone else in the room with you, or only if they're adults or minors with board business.
Got you. I am alone in the room myself. And Michael is in the physical location at DHS. Thank you, Michael. Thank you for dealing with the owl. Our currently temporary secretary, Philip.
Present, all by myself.
Thank you. Finance Director Shanda.
I am here and I am alone in the room.
Excellent, thank you. And let's see, we have Dr. Sandy.
I'm here and I am alone in the room.
Excellent. And Joe?
I'm here and I'm alone here.
Excellent. Rocco? Are you alone in the room, Rocco? You have to unmute and tell us.
Yes, I'm here and alone in the room.
Thank you. And then Rick. You're on mute. We can't hear you. Doesn't look like you're on mute, but we can't hear you. Can't hear you. Maybe you can introduce yourself in the chat for now and let us know no one is there with you. And then let's see, we have our Superintendent Education Designee. Beth is here, right?
Hi, this is Beth Schimmelfennig.
Anyone in the room with you, Beth?
No, there's no one here.
Thank you, wonderful. And then let's see, Dr. Camaron. I don't see him today. David Rodriguez.
Hi, present. No one in the room with me.
Thank you. And let's see. Is it Signe?
Yes, Signe Nakamura Reza. No one else is here with me.
Thank you. And Kristen, you're here now?
I'm here. Nobody's in the room with me.
Thank you. And please note that Rick typed in the chat he's here, and he's by himself. And then Thaddeus. Is that here?
Yeah, hi everyone. Thaddeus Van Peeham, and I am alone in the room.
Thank you so much. Wonderful. And then we have a few other additional people here today. So thank you very much for joining us. We appreciate you being here. And just so we know who's in the room, is that Roger I see?
Hi, yes, my name is Roger. I live on Oahu.
Wonderful. Thank you for joining us. And then we have, let's see, Joe is here. Joe Wilson.
Yes, hi everybody. Aloha.
Welcome. Nice to
Thank
have
you.
you here. And Mika is here.
Hi everyone, I'm here. The only other being in the room is my dog.
Thank you, Mika. Okay. And I know we have Erin here because we heard from her just a minute ago. And then I see Lisa P. Are you with us, Lisa? Well, she's joined, but maybe stepped away. All right, we're gonna get right down to it.
Kat, may I just confirm that Michael is the only one that is in the physical location and all the other commissioners are there via Zoom? Is that correct?
Oh, wait, I do see someone else there. Who do you
It's
have with
Andrew.
you, Michael?
Andrew?
Hi, everyone. My name is Andrew Ogata. I'm from the Hawaii Health and Harm Reduction Center.
Oh, wonderful. Welcome. Thank you.
Thank you.
All right, we don't have any written testimony that we need to go over. So let's start with our commissioner's shares or concerns. Michael, you had quite a few that you added into the board packet. So shall we start with you?
Sure, why not? You all have all my announcements in their concerns. I do want everybody to understand that just so everybody's aware of that the incoming administration spent $215 million on anti-trans ads. So the work of this commission is now greater than ever, and it's going to be harder than ever, given what we're seeing coming out of the what we plan to see come out of the upcoming administration, federal administration. So I don't want to belabor that point. I believe everything else is there in my the announcements, and that we will cover some other stuff later in the agenda, I believe.
Thank you, Michael. Other commissioners' shares and concerns? Sandy, do you have any? I think you're on mute.
Sorry about that. I forgot where I was muted. Okay, so I think that we should probably provide some information to the public about resources that they can access and things that they can look towards to find answers over the next few months. Not only is there going to be a lot of misinformation coming out, but I would imagine there's going to be a very slow trickle of information out of the actual administration, just because they're not going to want everyone to know what they're doing. So I think it'd be prudent on our part to make sure that the public is kept abreast as much as possible of things that resources that they can access.
Absolutely. Let's see. Philip, do you have any shares and concerns?
Not at this time. Thank you.
Okay, thanks. Let's see. How about Joe? Do you have any shares and concerns?
Mine would still be about the transportation issue, getting there for live meetings rather than just the Zoom ones.
And just to clarify, the issue would be the protocol or the procedure for reimbursement?
Right.
Okay. Noted. Okay, and then Rick, do you have any shares or concerns? Oh shoot, still no sound. Oh, I'm so sorry, your sound is not working. If you want to try and call in from your phone, that might help. Shanda, do you have any concerns?
I believe that my thoughts about providing input to the various different legislators is a discussion item. Is that item 9, the one that I emailed you?
Yes.
Okay,
Yes.
so I will defer for now. Thank you.
Excellent. Okay, got it. Thank you. And then let's see, Rocco, do you have any shares or concerns?
I think just echoing the things that Michael had submitted initially in the agenda are something that, that's a whole list of things, but, I really do think that it would be something for us to consider as a commission to definitely prepare some sort of a statement or some way to urge the governor to follow Governor Newsom in California, paying special attention to getting on board now. That's something that we would be pushing for as a commission, to make sure that these legal protections can actually be guaranteed, that they're on the forefront of our leaders' minds here in Hawaii. I think that would at least make stepping into this new administration feel like we have some sort of a battle plan.
Yeah.
Mm.
I 100% agree with that, getting ahead of it.
Thank you. And Roger, I see you put, I'll jump to you in just a second. Let me just make sure. Rick, were you able to dial in? Okay. Well, we'll have to give you a moment to share a bit when you figure out the sound situation. My shares and concerns are many, but there is a lot of work to be done. I just want to start off with saying thank you to Michael for preparing such an in-depth board packet. Very helpful, especially like all the history of the bills and everything and
Yes.
the links. That was very, very helpful, and I really, really appreciate that. We've been talking to multiple groups, and I've had folks reach out, including Joe Wilson, who's on today, and also Stonewall Caucus. And there's a lot of people who want to have discussions and who want to get to work. And I guess one of my concerns is going to be that we're going to have to be a little bit flexible and fluid with our agenda items, because like a whole month, a lot happens in a whole month, right? So everybody's grace on that as we try to move as rapidly as bureaucracy allows, in order for us to work together with some of these other groups and with all the people like Roger who want to get some work done. So Roger, at this point we have public testimony, so I would love to hear you put in the chat. Would you like to say a few words as well?
Yeah, as I said, I'm starting a new group, and it was in response to the election and realizing that there's a lot of people at home that are like me, that are just feeling crushed and afraid and fearful. And we wanted to start an in-person group and have a dedicated meeting time place to talk about some of the issues facing Hawaii and counter a lot of the misinformation. A lot of us have different parts and pieces of information about healthcare, about transgender rights, etc. And if there is one place where people can go to get that current information so that they're not spinning in their heads and doom scrolling all the time, it would be great. And so we thought we'd create kind of like different ways to meet in person or social media channels where we'd craft this message, and working with you would be great.
Thank you so much, Roger. We look forward to continuing to work with you, and you are most certainly welcome to join our meetings. And yeah, I think we're better together. Thaddeus.
Yeah, thanks, Kat. I just wanted to note in response to Roger, there's also a sexual and gender minority work group that's convened with the health department that has a pretty broad reach as well. So I'll put my info in the chat in case that's helpful for you folks, and also more than happy to share resources for your group.
Thank you.
Thank you. Thank you for the work you do, Thad. And then let's see. I know, Joe, that you all had emailed me. Did you want to say anything?
Well, thanks, Kat, and thanks everybody. I mean, as Michael and now everybody, I think, has said in one way or another, this commission was important, already, but post-election, this commission has a space, and then everything everyone is doing, Roger, Thaddeus, everybody, the things that you've been mentioning, just feel really critical. So I appreciate this space and the activists that are kind of putting their queer shoulder to the wheel, as Allen Ginsberg said a long time ago. We really need to do this. What Kat is referring to is, so my partner Dean Hamer and I are part of a collective called the Le Pua'ala Queer Histories of Hawaii Project, and we're doing a number of different initiatives to raise awareness about and honor the histories of LGBTQ Mahu folks over the decades and centuries here in Hawaii. And we were very excited to see on the agenda that Kat and Michael put out the idea of an initiative here to ensure that LGBTQ histories, realities, experiences are taught in our public schools, because education is the way we preserve and protect our future. So we'll look forward to jumping into that piece of the conversation when it comes up.
Thank you, Joe. And feel free to put a link in the chat there to your organization so everyone can learn a little bit more about that as well. Thank you for being here. Do I have any others who would like to give public testimony? Okay, then we'll keep moving. Next up, we have a discussion around the Pride Parade. So debriefing around the Pride Parade. And I know there was a little bit. I know, Philip, for example, you put your comments in the board packet. Who else would like to debrief about what went on in the Pride Parade? Oh, and Michael put some great details in there as well. I thought it went fantastic. It was like such a wonderful celebration, especially timing wise. It was something that we really needed, I think, to get us through what came next. But what do you all think? I know we didn't have a booth. I don't know how many of you actually went to the festival afterwards. It was quite crowded, quite crowded. I did not last very long there, for sure. And what I noticed, this is my debrief, the booths that were so popular were the ones that were giving out many things that we probably cannot afford on the budget that we're on. But very big thank you to Thad, who let us at least put up a sign at that booth. That was super helpful. But I do think being in the parade was not necessarily too expensive and very doable. And so many participated. So I thought that was really good. Anyone else?
I have something to add. I was probably the only one that wasn't there in person, but I saw the blurb on TV, and I felt really proud to have seen that little blurb with what's her name, the announcer coming up to you and talking to you, and saw Rocco and Rick holding up the sign and walking. It's like, oh, we're represented, even though just for that small little blurb there. So thank you.
Yeah, just to reiterate, I mean, I think it was great. And I think we should always make an effort to be there, just to spread the word to more and more people that we exist. The festival after was beyond insanely crowded. I mean, I question, really, besides handing out a lot of stuff, what's the value of that? But that's something we can discuss next year closer, really make that decision. It makes me wonder, though, are there other kinds of events where we might be more effective having a booth or a table?
Yeah. It was definitely not a venue where you could really be talking to people.
Right.
Yeah. Anyone else? Michael.
just real briefly, what I've already, besides sorting the thing, we didn't actually spend any of our budget that we put $300 aside. I just want to make sure everybody understands that none of the money we used, we allotted since the parade was free. That we were able to save that money there. And that as we look forward, I do that there are going to be other tabling opportunities out there for us in the future. And that's something that we will be looking at. And that's something that everybody should be looking for, not just mentioning it here in this meeting, but between meetings, going out and finding those opportunities for us. And we'll be talking about one later today.
Thank you, Michael. Anyone else about debriefing? Then we'll ask, how about preparations for next year?
I move that we table that till later on since we have such a busy agenda.
I think that's a good idea. Everyone's okay with that? Okay. Okay. Then let's see. Oh, discussion on the progress for hiring the administrative assistant. Kristen, please.
Chair,
let the-
did you ask for public testimony?
Oh, sorry. Public testimony on preparations for next year's parade
Or debriefing?
or debriefing. Thank you, Erin. Sorry. Okay. Kristen, is there a miracle?
So I just received today the third list of applicants that we can look through, and I'm starting to call out today to see if I can start scheduling anything for an interview. So I just got it today. And then also in regards to your folks' reimbursements, I am working with the directors and deputy secretaries who are able to do POs to look everything over and move it forward to the next part of the process.
Thank you, Kristen. I appreciate that.
No problem. But as for the administrative assistant, I just got it this morning. So I am calling as of once I got it this morning to start scheduling so we can find someone for you folks ASAP.
Thank you, Kristen. Kristen is being pulled to do some other duties there at DHS. But Kristen, for the meantime, until we have a secretary, you're still the go-to for all things travel or reimbursement related. Is that correct?
Yes, for travel and reimbursement. Yes.
Okay. Thank you so much.
You're welcome.
All right. Let's see. And also I'd just like to say I've seen many of you sharing the posting for the position online, and I appreciate that very much. Hopefully that's helping as well. And then let's see. Oh, so new secretary, Rick stepped down a few months ago, and Joan and Philip have both stepped up, taking turns to take notes for the meeting. But I would very much like to have an ongoing secretary.
I'm sure there probably won't be any, but we should just ask just in case if there's any public testimony on your agenda item.
Is there any public testimony? Okay, then I would like to nominate Philip to be our ongoing secretary.
Sorry, Chair, I meant about the administrative assistant position.
Oh, I'm sorry. You want public testimony on the administrative assistant?
Just the opportunity because it's an agenda item.
Okay, any public testimony? Okay. Any public testimony on having a new secretary for the commission? Okay. Maybe before we nominate and vote, though, we probably should. We wanted a little bit of clarification on the duties for the secretary, right, Philip? We were talking. Okay, so
Sure.
Aaron, you are on today. So just so we are clear on what it is the secretary is taking notes on, can we verify you need the start time and the end time of the meeting, you need the time of each vote, and you need the numbers on the vote, who voted yes, who voted no, who abstained? That's correct, right?
All of that is correct, and it tends to be more than that, right? And there has to be like a summary of the substance of the discussion. Any information that a board member wants to be reflected in the minutes has to be on there. and there might be a few various other requirements. It's under HRS section 92-9. And just so you know, whoever does become the secretary position, I'm happy to go over a draft when you make one, just to make sure that it's consistent with the requirements under HRS 92-9.
Okay, what form do you need that in? Because I think we sent you one from Philip, and I know you sent back that you had made the amendments or whatever, but then we couldn't see them. Is it best to do that in Google Word Doc, or?
Yeah, I only have Word document. Word. We're not allowed to use, or I'm not allowed in my office to use my state email to sign up for something like Google. So a Word document would be, or a Word document compliant, like you could do it in Google Docs, and I was able to open yours and see it. I'm not sure why it didn't translate over, because I did respond to everything and make comments to yours. But maybe I didn't realize you weren't able to read it, so maybe I can try like PDFing it. Would that help? Maybe.
I didn't see the comments. Michael, did you?
No, I was not on
sorry,
that.
Philip.
Oh, sorry.
Philip was on that one.
No, well, so I had sent the minutes with highlights, like, I'm not sure about this, I'm not sure about this. And then I got the email from, like, you had forwarded to Aaron, and I got it like, okay, I made some comments, or I meant, but then there was nothing attached. The only thing was attached was my original with all my highlights and question marks. That's all I got. I didn't get anything back.
Oh, I see. I think maybe if you might have to like open it in Google Docs to see it. Like rather than
You don't open it in Word.
attachments.
You have to open it in Word to actually see everything. Otherwise, you won't see the track changes. And you can't open it on a phone, and you can't open it on a tablet.
Yeah, I was on my laptop, but okay. I feel like I did open it, but I'll go back and check.
Okay, we'll work on that as long as we know what going forth. So Word Doc works, and we'll figure out a system on that one. Michael, you have your hand up?
Yeah, just to go back, question for Aaron on this is that with the recording should be able to capture everything that you mentioned towards the end about if people want something in the minutes, that it should be there. If we're using the recording as our basis for our minutes, is that correct? Because that's what I've seen in other commissions do.
Sorry, if you're doing recorded minutes, then everything that someone wants. So, but okay, so let's say, for example, someone wants this conversation specifically mentioned in the minutes. So not only would it be in the minutes in the recorded version, you would probably put some sort of documentation at this time, Commissioner so-and-so requested that this be reflected in the minutes. Okay. Does that make sense?
Yeah. Oh.
And as far as the summary goes, does the recorded notes, is that okay for the summary, or would the person still need to be summarizing every topic?
I would have to check. I think you would still at least need to put like the times, right, when all the discussions happened, but maybe not necessarily summarizing everything, because that would probably be more a requirement of written minutes as opposed to recorded minutes.
So the times
Discussion
of every
starts at whatever time discussion ended, vote was. There's a vote.
Okay. All right. Well, I'm hoping we're not scaring anyone off with this. Philip?
Yeah. Bye, everybody. It was nice. No, well, so the timing for discussions, not because what I thought when I did it temporarily in October it was the time of a vote, but now it's the time of everything. Like a discussion starts and then a discussion ends and then a vote. It's everything. Is that?
It would be like when it starts. It doesn't necessarily have to be when it ends, I believe. It's just a time stamp.
Okay. But
so,
on the vote, that sounds like you're saying it doesn't matter what time it was voted on, just what time the discussion started.
Well, what time the discussion, sorry, I don't want to confuse you. There should be a time stamp indicating when the discussion started of an agenda item, when motions are made, and when votes are made. So those 3 times.
Okay.
Discussions. Okay. Thank you for the clarification, Aaron. Yeah, we've been kind of unsure on all of this. Well, I would still very much like to nominate Philip. Would anyone like to second that?
I second it.
Okay. Do we have any other nominations? All right. All in favor of Philip?
Can I just say, may I chime in? You know, so, you know, Rick was the secretary and then he resigned and then Joe took a turn and I took a turn. And I just don't want it to look like I was like sabotaging something, you know, like I am perfectly happy to serve the commission in that way if that's what the commission decides or wants to do, but I don't want Rick to feel like, you know, somebody came in and shoved him out of the way. You know, it wasn't my intention, and frankly, it wasn't my idea to volunteer, but you know, Kat talked to me about it. So if that's what the commission, you know, desires, then that's the position. I'll be happy to serve that way. Thank you.
Thank you, Philip. All in favor of Philip as secretary? Aye.
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 Do I have any nays? Do I have any abstentions?
I'm abstaining.
Understandable.
So
All right.
is that 7 yes and 1? I couldn't keep. So you got to help me now.
7 yes and 1 abstention.
Okay.
That means you are it, Philip. Thank you very, very much.
Okay. Well, so I'm writing everything down everybody says, and every time you say it, I'm writing it down.
Great. That doesn't make me nervous at all. Okay. Well, wonderful. All right. So next, update on the commission's logo. So in the board packet, there were some taglines suggested. You all want to take a look at those. So it says, let's see, would you like me to read them too? A statewide program on the status of LGBTQ plus individuals in Hawaii. Improving Hawaii's interface with its LGBTQ plus commission. Advocating for the equity of the LGBTQ plus population of Hawaii. Advocating for the LGBTQ plus population of Hawaii. Planning and advocating for Hawaii's LGBTQ plus community. And ensuring Hawaii's LGBTQ plus community has a seat at the table. What do you all think? Those are all pretty good ones. We don't have it on here to vote for a tagline, but I guess I would ask you to consider which one of these you like best. And if it's not this one, if you have another one you prefer, maybe we can vote on this for next meeting.
I like the advocating for the LGBTQ plus population of Hawaii. It seems kind of inclusive of kind of everything we're doing rather than pigeonholing it into one.
I
You said
also
the advocating for the equity one?
No, the one that says advocating for LGBTQ plus population of Hawaii.
Yeah, I like
Rocco,
that
you like that too?
I agree.
I
was
think
gonna say that.
the least wordy and it gets right to the point. It says exactly what
True, right? Tagline should be short.
I think short is better. People don't read things. I mean, they don't. So if it's long, they like, forget it. I don't care. So short is good, I think.
Okay. Then that is the one that we will propose to vote on for next meeting, if that's all right. Sounds good to me. And then the logo policy, let's see, Michael included it in here. No, not yet.
Well, I can,
Asking public testimony on the last agenda item.
wait.
Sorry, what?
Public testimony.
Yes, thank you.
On the tagline? Do I have public testimony on the tagline?
That's not on the agenda.
Public testimony?
Not until after we talk about logo policy.
Correct, that's true.
Sorry about that. I just wanted to make sure that we weren't moving on without having an opportunity. Thank you.
Okay, do we have a logo policy?
No, I did look for one to use as a template, you know, and I'm not having a lot of luck finding it. Finding one, I reached out to a couple people, and I didn't really get a response. So I am still working on it and hope to have something for next time, unless somebody else, you know, finds something first. Actually, if you do and you want to just send it to me, and then I can, you know, edit it to suit our purposes, but I wasn't really finding anything.
Thank you for trying.
You're welcome.
Yeah.
Public testimony on that?
A question, when you say logo policy, are you talking about things like authorized use, design standards, enforcement, that sort of thing?
We have a design, we have a logo, we just are not clear on the use of it and how it can and how it cannot be used, etc.
If you have
So
So you're looking for an example, like
of a use policy.
Okay, yeah.
Logo use policy, yeah. So if you have one.
Yeah, I've seen them, and I can probably find one because I do work in product design. So
okay.
Wonderful.
Yeah.
Thank you.
That'd be great. Thank you.
We also have one at the Hawaii LGBT Legacy Foundation, and I can send over our logo use policy that we use for Honolulu Pride.
Yeah.
Yes. Awesome. Thank you. That would be so helpful.
I can also ask our PIO. She has the logo policy for DHS.
Sweet. Thank you. Stop.
Kristen, if we get one from the Legacy Foundation, does it have to go through DHS for approval, or is the path of least resistance to use yours?
I need to ask Amanda on that.
Okay.
I don't know if it has to follow. I would think it would have to follow DHS policy, as the commission is part of DHS.
Okay. Yeah, let us
So
know.
let me see if I can get a response from her, and then I will send it to you guys right away.
Thank you.
Thank you.
Let's see, public testimony. Did I ask for that already for commission's logo policy? Thank you to the public for helping. And then update on commission's media and marketing materials. So we have in the board packet number 8 here, looks like. And Shanda, you worked on the letterhead. Thank you very much. That's wonderful. I hope you all got a chance to look at that. Anyone want to discuss anything regarding anything to do with media and marketing that you're seeing?
Just real briefly, if you look at your board packet, you'll see the 4 different social media platforms we have.
Yeah.
And if you haven't already done so and you're on any of those, you should be liking and sharing as a commissioner to help getting the word out there on what we're doing. And we're going to be trying to build up those numbers between now and the end of time.
For sure. Yeah, I have a lot of Facebook followers, but I'm old, so the other things, yeah, somebody else has to work harder on that than I. Getting it out there. Anyone else want to discuss anything having to do with the media platforms?
I would just like to commend Michael for his diligence and consistent ability to craft meaningful content and keep it coming. Thank you so much.
Absolutely.
Ditto.
And let's keep sharing it because Michael works hard on that. Commission webpage. Did anyone have anything to talk about under media marketing and regarding the webpage?
I do. I looked at it. I was looking at the board packet and I clicked on the link that says commission website, and I'm trying to pull it up on one of my many devices that I'm on right now. But it's like there's the logo and then there's a little bit of text and then it says agenda. board packet YouTube. If you click on the agenda or board packet, it's August. And so that seems dated to me, like that doesn't seem right. And then if you go down, more text, and then it'll say August, September, October, November, but it's weird that it feels like this is the marker for agendas and the only one there is August. So I don't know if those things, I wish I could have a visual to show you. You know what I'm saying?
No, I'm looking at it right now.
So if you see the logo and you see 2 paragraphs of text, and then under that, there are 3 links: agenda, I think it says board packet, and YouTube. If you click on agenda, oops.
I'm
Oh,
sharing my screen.
Oh, look how magic you are. Yeah, it's right there.
Yeah,
So
if you click on this link, then it just takes you
it
to
just brings you August.
Okay, so we don't belabor the issue, those should have been taken off.
Okay.
We're gonna have them taken off, and we're gonna, well, especially when we do the update for this meeting, we add the agenda, the recording, and the board packet links.
At the
like you
bottom.
see at the
Perfect.
bottom. We're gonna get those removed.
Okay, perfect. Thank you.
Thank you, Michael. Thanks for the
But
question.
and also, huge thank you to Sean. If Kristen, if you could pass along our thank you to Sean for doing the updates for us.
Of course, no problem.
Yeah, and if you all spend any time on the website page, we should always be thinking about how to improve that. And when we talk about resources and everything, I think, like Sandy was saying in her concerns, I mean, we should think about, is this a place where we can then use also as a resource page, right? So
That'd be great.
let's think about how we might use our website and how we could keep improving it. Michael.
On that note, that people start compiling your list of resources and don't just, because it's you until further notice, I will take those in and we will so there's just one person reaching out for updates to the website at this point. And don't just give me names, it has to be names and a URL.
Oh yeah.
And or ideas of what can be done, because I don't need any idea fairies. We need actual things that we can put up.
Idea fairies. Okay, thank you, Michael. Public testimony on anything to do with media and marketing materials? Okay, then we'll move on to number 9, input and guidance to the legislature. So Shanda had actually brought this one up and thinking about how to address recommended legislative and administrative action. Shanda, do you want to say a couple words about this?
Yes, I was hoping for us to problem solve a bit here. The first of which, how can we, in a more targeted manner than a simple press statement, best notify each individual member of the Senate and the House that we are available for feedback and input, and if they want to know how a bill they have already crafted or one that they are thinking of might affect our community, that they can come to us for input, and if they would like our endorsement or us to participate in creating legislation, that we are available for that, because I don't know how much they all know that we're here. So how do we do that?
May I think our introduction comes with, once we figure out what our legislative priorities are, that we then send those legislative priorities over to them. These are the things that we're looking at, and then that if there's anything on this list that they're interested in, that we're here as a resource. A similar letter should be sent out, not just to the legislators, but also to all the department heads, because we are supposed to be here, not just for the departments that are represented on the commission, but for all state departments. So if there are issues that come up, that we are there by statute, we are the people that they should reach out to when it comes to queer issues. So that is the appropriate channel, as it were. As individuals, if there's a specialty that you have, there's nothing that stops you from reaching out to a legislator individually. Especially once we get, we know who all the chairs are And those are gonna be the power players. When it comes to our issues, department, obviously the chair of health, the chair of judiciary, the chair, those are gonna be the two big ones, both in the House and the Senate. That we are going to, maybe at a future meeting, invite them or a representative to come talk to us. So that they know that we're here, or, and to help, because we are part of the state government now. And that this is, what we're here, this is what we're here to do.
Love that.
So what you're saying, Michael, is we should wait until we define our legislative priorities and then notify each individual member and committee chair as well as the department heads in government. Am I understanding you correctly?
Those are two different things. One is talking to the department heads, letting them know that we're here. The other one is our legislative priorities, and that goes to every member of the legislature, even those that we might think are hostile to our movement. But we can always exclude them or not. It's going to be up to the discretion of the chair how she crafts that letter, and so there's no need to vote on this. It's through the general work of the commission. Once we figure out our things. Figure out what our priorities are.
Okay, and I would like to add to that I think in addition to our legislative priorities, I would also like to see us essentially notify anybody we can individually that we are available for input and feedback on anything that is not necessarily on our priority list, but that could be, well, basically anything, because then they can come to us and say, hey, we have this bill on roads. Do you think your community has any input on this bill? And we may or may not have any input, but they can certainly bring to us because we all live in every aspect of the state. And so if they're interested in getting our input and feedback, they can come to us.
That I'm gonna say roads are outside of the mission scope of this commission. That's mission drift. We need to we have a lot of work to do just within the queer issue. So I would advise against that. That we are here as a resource when it comes to queer issues and how these issues impact our community.
But I do think it's valid that we continue to listen and to, unite, even if it isn't our legislative priorities, because I think this is just going to be such a huge year of change and of new problems that we didn't even anticipate. So I do think it's good that we are always out there and listening and trying to, have a united front when we can, when it does affect the issues that we are commissioned to handle, right?
Yeah, I'm gonna have to agree with Shanda and Kathleen, because like when the interstate system was first created in the 1920s, 1930s, 1940s, a lot of laws were used against LGBT people at the time from traveling on those roads based on things that were considered pornography in the transportation of. And so it was a lot of gay activism that prevented those laws from being enforced and things like that. So you never know what type of legislation that is going to crop up that's going to sneak in something that's going to prevent us from being able to exercise our freedom. So I agree with y'all, keep our tentacles, feeling everything and our antennas up and making sure that we're aware of all of the things that are happening.
Yeah. Yeah, I think it's going to be one of these things where even when we're in session, as we're working on things, there'll be things coming up that we know we're going to have to work on for the next year. It's like it's going to be a continual, right? Public testimony on this. I'm sorry, did I hear someone? No? Okay. And now we're going to get to the review of proposed and brainstorming commission legislative priorities for the 2025 session. You will notice in your board packet that Michael so diligently prepared all of these answers here. There were questions that were submitted, and all of those questions were answered in the board packet, the ones that were submitted. So I would just ask, because there's so much to talk about, that we might refrain from asking any of the questions already answered in the board packet. But if any of those need clarification, then we could do that. But okay, so let's just start here. Yeah. Who wants to start with, should we just go down the list? Number 1, expanding gender markers.
Did we pick up where we left off last time, or are we gonna start all over? from the
Oh, yeah.
beginning?
I'm sorry. Where did we leave off?
I believe we were on number 6.
Okay. Amending the surrogacy laws, so queer and straight couples do not have to adopt their own children. And Michael put in the link to the draft there of the draft bill. Any discussion around this?
We already have a draft bill that we can support coming from the Parentage Task Force, so this would be an easy get for us. So there's not a heavy lift when it comes to this one. That's all I have to say on that.
Mm-hmm. I think we're going to vote on all of these after we discuss them all. So, yeah, if you have anything that you need to ask or discuss to help you decide whether or not you're voting for it, now would be the time. All right, number 7 is establishing emergency low barrier shelters on all islands for homeless unaccompanied minors. Discussions? Okay.
Just really briefly on this one, this is gonna be a heavy lift, just so everybody knows that we're heading into, not just dark times federally, but locally. I've heard through the grapevine that everybody needs to start tightening their belts, so there probably will not be an expansion of any, unfortunately. Well, this would be this would be an expansion of programs out there. So it's gonna be a heavier lift on anything to do with money is gonna be a really hard nut to crack. But it doesn't mean that we shouldn't put it out there to remind people that this is, looking at it from a Honolulu's perspective, we have the 11th largest city in the US, and we are the only one out of the 11 that does not have emergency shelters for homeless and unaccompanied minors. Rise is 18 and over. They were allowed during the pandemic to bring in under 18, but that program is unfortunately in jeopardy every day. So just things to think about.
Thank you, Michael. Rocco.
Just based on the way this question is, or this is proposed, we're not talking about establishing like new programs, right? Just expanding the focus on LGBTQ youth. Is that the idea behind it?
No, it would be expanding programs. There are no shelters, emergency shelters that require you, everything out there requires you to be part of the system at this point. Right. Be a foster system, that like you would have, be able to walk in, a kid that runs away from home has one place to go, so they don't have to go into the system.
Right, okay.
Thaddeus has his hand raised.
Oh, Thaddeus, please.
Yeah, sorry, this is regarding the previous bill on surrogacy. So I just wanted to note that the Parentage Task Force, as Michael had mentioned, did draft a report and also a draft bill to put forth to the legislature. So just recommending that the commission members review that when it comes out. I don't think it's out yet.
No, it's on the website and the link is in the board packet.
Awesome. Thank you, Michael.
Anyone else regarding The shelters?
I just want to say thank you, Michael, for bringing that up because that's what I was worried about after the fires in Lahaina was where were all those kids going to be going and where were they disappearing and who was taking care of them? You know, I know they're out there and I was just worried about them.
I just want to say I find this to be one of the most important things that we'll be working on. So I hope a lot of the commissioners will get behind this and help us out.
Thanks.
Okay.
I just wanted to share that I believe Yo might be still a walk-in shelter. I believe it's located in Waikiki. It's run through Halekipa. It's one of the only like shelter-ish facilities for youth right now. And I do know that I'm pretty sure they don't need referral from CAMHD or DOH to receive services. But it's only on Oahu. There are additional programs being brought up every day, but they're still being vetted by DOH, CAMHD, and some of the neighbor islands.
Daddies, is there an age restriction or that they have to be before they get accepted into that place?
I think it was Mika that was speaking.
Okay.
I can answer that question. There is no that at Yo, they have a certain age range. They do turn a blind eye because it's not a shelter. It's a drop-in center. So it's open 4 hours a day, 4 days a week, where the kids can come in, take showers. They help them with their GED. They can try to get them access to medical care. It's run through Waikiki Help and what's the other one?
Halekipa, I think, is the other agency.
It's a partnership between those two. And so it's not a shelter. It's just a drop-in center. There's so yeah. And that's only
Good
if
to
you
know.
If you do know of any kids though, I do know that CAMHD, you can reach out to the family guidance centers to try and get them services started. I do know that we try to partner with different agencies as far as trying to find placement and trying to get them mental health services if they do have if they either don't have insurance or if they currently are on MedQuest, they are eligible, and we can walk them the families through actual step by step to get them services if needed.
And the problem with that is if the kids run away from home, you don't get the parents' approval, therefore they can't access those services.
Yeah, I see them when they come through the judiciary side. So I know that a lot of it, there are quite a bit of kids that run away. Otherwise, I knew when if you know people in the school system, try and reach out to like the SACs. I was a former VHS, so try and reach out to like the student activity coordinators to try and get them services through the school, and they can try and refer that way as well. Just unfortunately right now, there are not a lot of residential facilities in the state for youth. I know Kahimuhala, I think, is just starting to open up again for the residential services side.
Thank you. Anyone else on that one?
Just a recommendation that if it's helpful to the board for future meetings, perhaps consider inviting some of the folks who provide the services to answer the questions for you folks.
Mm-hmm. That's great.
Oh, and
Okay,
then, sorry, one more thing. I do recall that there was a street youth survey that was done with Yo and Halekipa. I'll try to find it and put in the chat for you folks as well. I think it was back in 2018 or something.
Thank you. Okay, then we have a complete review of the Hawaii Revised Statutes to go to gender neutral language and amend any heteronormative terms or phrases.
For this one, it's gonna be my recommendation that we do this through resolution, a concurrent resolution, that they set up a task force. We've asked for this multiple times and they're like, oh, no need a resolution. We'll use staff time to do it and get it done. And that has not happened for the last 4 years. That this keeps on being brought up. So while there's because there's no time to do the, write the bill. Resolutions, have a different timeline, as you all will know, because you all went through all the training with PAR that was provided to you and after the Pride Parade and is included in your board packet. So that,
Yep. Yes. Okay, so when we vote, we'll add on there a resolution to get a task force. Anyone else want to discuss around that? Okay, and then we have establishing an education requirement of teaching LGBTQIA+, MVP, FAFF+ history, our achievements and contributions in public schools K-12 and UH system. Discussions around that, and I know that we have on here Joe and Dean, who also reached out to us about that.
yeah, so, well, just real briefly, again, that there are 3 ways to go at this: Board of Education, legislature, and resolution. So, but if it's okay with the chair, I think we should hear from Dean or Joe at this time.
Yeah.
I'll talk. Hi, everybody. I'm Dean Hamer, and I'm with Joe Wilson, and we're with the Leipua'ala Queer Histories of Hawaii project. We've been interested from the very beginning in the possibility of bringing more LGBTQ education to our school system here, with the idea that this is really where prejudice starts early on and where it's best fought, and that it has a great potential for long-lasting effects. I think everybody would agree with that. The question is how to go about that. And we've actually been looking at this since we started our work with A Place in the Middle and the Kumuhina project back in 2014, and started interfacing with the Department of Education and with a variety of different queer and non-queer educational groups, both here and also nationwide. So as Michael mentioned, one possibility is to seek legislation that would require or mandate LGBTQ education. Another possibility is to work directly with the Department of Education. And a third is a resolution. And we've begun to have conversations with a variety of people. Although mandating education would certainly be a strong move, and it's one that has been pursued starting in California and is now, I think, in 6 different states. It's also a quite difficult route. And actually, it's probably more difficult in Hawaii than it is in most places, even though we have a statewide education system, because as a result of having a statewide DOE, the DOE is quite resistant to having legislatures tell them what they should teach. They already have a board, it's already part of the state. So in looking at DOE curriculum requirements now, there is actually no special groups that are included except for education about handicapped or disabled individuals, because the DOE has been so resistant to that. So as we were looking around, one example came up fairly recently that seems like a really good one. And you might have seen the article in today's paper. I was going to say the Star Advertiser, but that is the paper, about Filipino education. And there was a group of students, actually Filipino students, who started this back in, I think, 2021. They noticed there was no educational courses about Filipino culture or history in any of the schools. So they started working on developing a curriculum. And the mom of the young woman who was the head of this is also on the curriculum studies program at UH. So they had excellent advice. And they developed a curriculum, and then they got a resolution through the legislature that requested the DOE to implement a course on Filipino history and culture. And once that got passed, which it did so unanimously, they were then able to start implementing this course, and it's now being taught in 2 schools and will widen out to several more schools in the coming year. So we kind of looked at that language, and it's for a social studies course. It's in senior grades. It's quite specific, but it also seems very sort of doable. And we thought maybe that might be a good first step to start with. So yeah, that's sort of where we are.
Let me just add one quick thing, which is in addition to what Dean said, the other conversation that we started was with the Stonewall Caucus of the Democratic Party, thinking that that would be a good place to do some initial research and strategizing. So we've been talking to Abby and Lynn about forming a working group, which would consist of local experts, issue advocates, and others with similar experience to begin to develop what we think might be the most effective and workable strategy here. And if that sounds of interest to you, I would invite members of the commission to think about being involved in that. Kat, I know you already bring certain expertise, and we're thrilled that you might be able to participate in that. But suggestions on resources, et cetera. Michael, you're obviously a key strategic thinker with experience in these areas. So that's one thing that we're starting that could help shape how we do this and do it with the most chance of success.
So you are all thinking of, for this legislative session, drafting a bill?
It wouldn't be a bill, it would be a resolution.
Resolution.
Yeah, a resolution. And we have made a start on that. It's whereas Hawaii has an amazing history of LGBTQ history, and whereas Hawaii has traditional and customary practices that involve aikani and mahu, which in the Constitution should be taught. And whereas research has shown that schools with LGBTQ curricula have better regard and respect for all students, et cetera. Therefore, it's just a request that the DOE implement a course in LGBTQ history and contributions. So it doesn't require any money from them, which is like super important.
Where are you getting that course from, just so I know, like who's developing the course?
Here's the big question. That would be what's under discussion. And there's plenty of content at this point, especially for a senior social studies course. There's tons of we already have a curricula that were developed for a place in the middle, and also for Kapai Mahu, which was done in association with Kanaio Kana, which is the network of Hawaiian focused schools. So yeah, this would be a starting point.
Yeah, because I think that's the one thing the DOE is going to ask. What will it cost us?
Yep.
In both human power and money. Michael, you have your hand up?
Oh, yeah, I was just, Andrew does need to leave here like 10 minutes. And I know he's the first on the new business agenda. So if there's any way we could pause this and come back to it, at least so we can hear from Andrew.
Sure.
And then just hear from him, and then we can take up the discussion and vote on that item later. But
absolutely. Yes, please.
So I so move that we take pause this agenda and take out of order, move to item 3.1 for the presentation from Andrew from the Hawaii State Harmon Production Conference, Rainbow Resilience.
Hi, everyone. Thank you so much for making the accommodation. Sorry, I did not realize that this meeting would go on so long. I do have another.
Was there a motion and a vote?
Wait, hold on. There's a motion on the floor. I need a second.
I second it.
All in favor? Aye.
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 Against? Any abstentions? Okay, so moved.
Cool. Thank you, everyone. Once again, my name is Andrew Ogata. I'm the Director of Marketing over at the Hawaii Health and Harm Reduction Center, but I'm also the Vice Chair of the Hawaii LGBT Legacy Foundation. So I work a lot in the community, but every odd year, HHHRC, traditionally with other community partners like Papa'ololakahi, the State Department of Health, Thaddeus over there. And the previously Harm Reduction Hawaii, we would put together a harm reduction conference. We've been doing it since 2009, I believe, was the very first one. And we actually, Hawaii, had the first statewide harm reduction conference in the country. And so this year, the theme is all around LGBT issues. It's called Rainbow Resilience. And so we're just looking for community partners to support us in becoming a sponsor, and this would be a great tabling opportunity. There will be approximately 400 people attending this conference. There will be policymakers, public health professionals, as well as community members. We try to keep this conference as low cost as possible. So it's not, we just have our sponsorships at 500, 1,000. And I also, I printed these because I thought, sorry, that people would be here in person today, but I sent Michael the document and he can send it out to you folks, but this is just a working document. Oh no, that's the wrong one, sorry. This is just a working document of what our agenda looks like. What we've broken up our conference is into 4 different tracks, one on community and programming, one on culture and native issues, advocacy, and wellness. So we have a list of, none of these topics are finalized yet, but we just have a working list of some of the different topics that our community members have asked for or suggested. And we have a list of people that we think would be appropriate experts to kind of present these topics. So as soon as Michael can pull it up, you can kind of see kind of like what the culture of the conference will be like. Okay. So harm reduction 2025, intentional harm reduction efforts in non-traditional programs, community listening session on how to reduce harm for LGBTQIA+ and QTPI people in hospital settings, community listening sessions with HMSA and insurance companies overcoming barriers for LGBTQIA people with insurance companies. And then we have an entire track on cultural and native. Kumuhina is one of our advisors in this, and so we have a native wine toolkit, a whole session on Mahu, Lydia House, which is a nonprofit that actually does work with runaway kids. Now that I think about it, Lydia House, they're run by Queen Liliuokalani Center. They work with under 18-year-olds. And then yeah, you folks can kind of look it over, but these are the different tracks, and these are some of the different issues that we're hoping to tackle. And our conference every year has sold out. So we're expecting a full packed house of 400 people. It'll be at the University of Hawaii at Manoa. And in their ballroom, and the breakout sessions will be in Campus Center. Are there any questions?
For sure. So obviously you're looking for sponsors and we don't have a lot of funds, but what other ways might we support? Do you need volunteers? What do you need?
Sponsorship would be great, but I understand you folks are working with a limited budget, but also we'd love to have your input. Michael attends our meetings pretty regularly, but if anybody else on the commission is interested in attending these meetings, I can have Michael pass it along to you folks. They happen about once every other week. We're hoping to do a statewide conference. So I know neighbor islands, folks are all represented on here. We're doing special scholarships and travel scholarships specifically to bring over queer people from neighbor islands to come and be represented in this conference as well.
I clicked on the link, so I mean, obviously we can also sign up to go to this, right? There's a minimum registration fee.
And it is an all-day conference.
Yes, it was all day, and it'll be from 8:30 to 4:30 at the campus center. All meals are included as well for attendees.
I'm curious.
Yes.
Oh, I'm just curious. Who attends this conference? Like, who are the people that are actually going through there? What are the demographics like?
There's a lot. It's a lot of policymakers. We usually have several people from state legislature as well as city council that attend. We've had the governor in attendance in the past. We purposely make it in January before the legislative session because we like to have a whole advocacy track and we really like to put LGBT issues at the forefront of whoever we can. Also, a lot of social workers, public health professionals, because we do offer continuing educational units for people that require them for their like LCS licensed clinical social worker, LCSWs, anything like that. If they need any CEUs, we are able to give up that, or also CSAC CEUs as well. And then we also do get a lot of community members as well, just random people that want to be involved in like LGBT or harm. The previous conferences have all been very structured around harm reduction. So a lot of people who use drugs and working with people who use drugs and whatnot. This one is we're shifting the focus to harm reduction through an LGBTQIA lens. So yeah, all of the issues will relate back to the LGBT community. But yeah.
Nice.
Sorry. I see a couple of hands. Rick, I think.
Yes, I just wanted to make a plug. Can you hear me?
Yes.
Yes.
Can you guys hear me? Okay. Oh, cool. Make a plug. I signed up, and it's only $60 for 6 hours of CEUs. A lot of times, 6 hours will cost me $200. So the $60 for 6 CEUs. Shanda, you might want to check it out if they give the nurse practitioner hours too. But for the LCSW, it's really a bargain. So thank you, Andrew.
Yeah, no, we don't view this conference as like a money-making tool. We definitely try to do this as a service to the community. So we try to keep things as affordable as possible. We use the sponsorship to help cover our costs of the food and the conference and all of our staff time and things like that. And then, sorry, I can't read your name. What's your name? Joe.
Joe, Andrew, you might have mentioned it, but I just didn't get the date.
Yes.
When was it for?
January 10th. It's January 10th. Friday, January 10th at the University of Hawaii at Manoa Campus Center Ballroom.
Okay. Thank you.
I have a question.
Yes.
I see there's 2 different levels of sponsorship. What does one entitle us to, a table or a booth, or like what, or is it just, just a donation, sort of a donation?
Both will get you a table, and both will come with 2 complimentary admissions for whoever's tabling can join in the conference. But it's just basically larger logo placement. We're also going to do like a harm reduction conference shirt with our logo that's in the packet that people purchase. And so one, you get your logo on the shirt, the other one you don't. So it's different marketable differences.
Thank you.
But both will come with a table.
I have a question.
Yeah.
Yes.
Okay. Are we going to be discussing then the possibility of the $500 sponsorship level today? Or is that something we'll be talking about at a future date? I guess it's coming up pretty soon though.
We are. It's on our agenda to vote. Just so we're pausing the agenda. We're gonna go back and finish the legislative piece and then come back and vote on this. So, but this is your chance to ask Andrew any questions. And this will also give you an opportunity while we're doing everything else to click on the links that were provided to you in your board packet. It will show you everything on the website. And also have all the information.
Mm-hmm.
Cool. Any other questions for me while I'm here? Again, I appreciate you folks disrupting the flow of your meeting for me and giving us this opportunity to kind of pick your brain and invite you folks to participate with the Harm Reduction Conference.
Thank you so much for coming.
Thank you.
The conference.
Thank you.
Okay. Let me get back to where we were. Let's see. Oh. Okay, we were discussing, we were hearing from Dean and Joe, and we were discussing the education requirement. So were there any other questions around that? Or any other discussions?
Yes, I have one. I just wondered if Beth could give us any insight on what would be a good way to contact the Board of Education in this regard when we're talking about these things.
I don't think we're going to contact them yet, but
Oh, no, I'm just saying, what would be the process?
so in the chat, I would bring up that they said that, let's see, let me read where it said. So Dean and Joe, you're already meeting. Oh no, Thad said he's meeting. Let's see. Thad is inviting Dean and Joe. We set up a monthly meeting in collab with DOE to explore issues and LGBTQ plus needs. Okay. So Thad, do you know who you meet with when you meet?
Yeah, we don't, yeah, sure. We don't meet with the board. We meet with DOE. So we meet with actually school level, so principals and teachers, complex level, and then the actual Department of Ed folks. And the main coordinator is CJ. I forget her last name, but she was worked on a lot of LGBTQ plus issues in the past as well. So she ensures that they're committed to kind of continuing conversation. We also include the DOE civil rights compliance folks to kind of bring in that legal side and to update that as well. So I offered that because I think maybe that'd be a great start for Dean and Joe to kind of have that discussion. This actually little body had started because we had been pushing for comprehensive sex ed. So curricula was part of the discussion as well.
I would love to be a part of that discussion. Please and thank you.
Oh, great. Yeah. Maybe just email me if folks are interested and I'll try to loop everyone in.
Thank you.
So Beth, did you wanna have any response to Rick's question? Like if and when we are approaching the school board, what might that look like?
Well, I would assume that we would need to, actually, I would need to look into that, but I think that we would have to run this by the superintendent and then approach the Board of Education chair. The secretary is lady, and she's very easy to talk with and, you know, get her viewpoint on how we would best approach this request. And I also would like, you know, to follow up on Thaddeus. I am this representing the superintendent here with the Civil Rights Compliance branch, but the person who I believe is the best link for civil rights would be Nicole Ijima.
Yeah, we work with
Right.
her. Yeah.
Yeah, she's on our staff and she's amazing. And I'd really like to get her involved.
Great.
Well, it sounds like we probably need to be working with you all and then figure out what it is we actually are asking for before we would approach the board, though.
Yes. Thank you.
Sure. Any other discussion on that before we move on to number 10, our final and last one before we vote, I think? Yes.
Are there any members of the commission that might be interested in being invited to participate in any working group meetings? Sandy, Kat,
And
Joe, and Rick.
I would like to know a little bit more of what the requirements are before I commit. I just have a little bit of time restraints, that's why.
Okay, we don't have any requirements yet, except we're looking for ideas, expertise, guidance. I would say it's as open-ended as needed, and we welcome all, you know, constructive input. So Mika, yeah, we could keep you in the loop.
I appreciate it. Oh,
I
thank you.
Provide
I
any.
have a question, if I may. So, this is, I guess, more sunshine law. If bunch of us are wanting to participate in that, how does that create? What kind of challenges does that create? What do we have to do in order to allow? It sounds like 5 or 6 of us would like to be interested. I mean, would like to participate.
In
In the
restriction.
So you should be able to go. Obviously, you can't, you shouldn't be talking about board business or making any commitments to vote. But yeah, you should be able to attend the conference.
No,
Well, no, I'm
Aaron,
not
sorry,
the
this
proper.
is a working group. It's 4 or less for a working group, but I think we have to create a pig.
I'm sorry. You want to
It's-
working? Wait.
To join an external working group. It's not.
It's not part of the commission, right? Correct?
No, this
Correct.
would be individual interest, correct, Joe and Dean?
It
Yeah,
would
these are
be,
just
we would,
individual
we're
interests.
asking people to participate in their either individual or professional capacity. So Kat, University of Hawaii professor of, education, et cetera. So that would be at least our view of it.
Yeah.
Okay. Then yeah, it would be individual. This wouldn't it would be your own individual interest, right?
But if we're all there, that's okay. If we're all there representing the rest of our world, it doesn't create.
Well, you're there in your individual capacities, not as a board member, correct?
Yes. Correct. Okay, great. Okay, so then our last one is ensuring that LGBTQ plus IA plus MVP FAFF plus community has access to mental health care on islands through education requirement for relicensing of mental health professionals. Anyone?
This was tackled before. It was built together with we built a coalition with the Hawaiian community. We're not expecting mental health professionals to be experts in this field, but just so people understand that this came about because members of the queer community, especially on the neighbor islands, were being turned away from mental health professionals because they had no knowledge of the LGBTQIA plus community at all. And so they're like, oh, I don't know what you're talking about. I don't know this, blah, blah, blah. So I can't help you. And there's very few mental health professionals available, especially on the neighbor islands, except for telehealth. Telehealth is actually helping to open that area, but to be able to at least have these people at least have a bare knuckle understanding through these because they all have to go through, like we just talked about, the continuing education requirements to keep up their licenses. So that making this a part of the requirement. And we got it through one chamber and it died in the other chamber, and I don't remember which is which. So
I have a question about that. So like I'm all for that. What prevents a therapist or social worker from still, for instance, I know when you have an intake interview with a counselor or therapist and they say, oh, I don't deal with it. I don't deal with addiction, or I don't deal with, sexual abuse or something. So couldn't they just say, I don't deal with queer issues? And I think it's a great idea. I'm just curious about that part. Can they still work around it?
it depends on how we write the legislation and the way, yes, they are going to be able to say no, but at least this helps remove the barriers and helps remove the excuses. So they can't, oh, I don't know that, that's not my specialty. And they're like, I'm depressed.
Right.
I'm just seeking help, period. So we're looking at, we're not gonna have all the answers on all these things, and just like doing our best to make sure that we can remove some of the barriers. And, yeah, so we were able to tackle this. This was one of the, this came out of the task force that when we banned conversion therapy back, years ago, was that? Well, something like that, whatever. This was one of the suggestions that came out of that task force is access to mental health care for LGBTQIA. So one of the ways to get access is making sure that there are individuals have the at least know what the letters mean.
Right. Thank you.
Rick?
I did a little research on this because it is a very important issue. And so I did speak with the Hawaii Psychological Association, the Hawaii chapter of National Association of Social Work, and the local Marriage and Family Therapy Association. One of the things that I found, well, there were a couple things. The biggest challenge or barrier is the lack of mental health providers in general, both on Oahu and in neighbor islands. And it's even worse on the neighbor islands. Very, very hard. It's like 6 months for a patient to get a provider appointment, okay? The second thing that they pointed out was that generally speaking, the biggest training that are provided statewide, for example, the State Behavioral Health Conference that they held in September, and then they also held the Hawaii Mental Health Conference, where those were a joint function of those three organizations, always do include a LGBTQ track that you can, so the trainings are there. I think our time could be, I think it would be beneficial in the short term if we worked on trying to increase those trainings. Like I said, people have to pay for continuing education units. If we could figure out some way to assist at Department of Education, some of these professional boards, in providing free continuing education for this area, I think we'd be able to get knowledgeable staff out there quicker. I also, I mean, I see the end result is very important. They actually didn't believe that many therapists were turning away or that weren't knowledgeable anymore about LGBTQ issues. They felt that most professionals do go through that thing. But anyway, it's just another idea, something that we could approach, another avenue to approach this goal.
Folks, we have, 19 minutes left. So any other questions or clarification needed on this one? All right, let's get some public testimony first. Any public testimony on any of those? All right, then let's get to voting. How about that? We are going to.
Hey, Kat?
Yes.
Are we going to go one by one and vote, or we have to either accept all? Okay, one by one. Okay,
nope, one by one. That's why we got to get to it, because we have to vote on items for priorities and vote to decide on lead for each legislative policy priority. So we'll go through and vote on them first as items, and then we can decide on the lead for each, if that works for everyone. Because there's a couple things under new business we really need to get to. Okay, so for the first one, expanding gender marker for birth certificates. Do I have a movement for this?
I move that we make this one of our priorities.
Do I have a second?
Second.
Anyone who abstains? All right, then anyone who is voting no? I'm going backwards with this. Then everyone agrees. We are passing that. Yes. Number 2, requiring health insurance policies cover gender affirming care procedures. Do I have a movement for that?
Make a
one?
motion.
Second?
Second.
Okay, any abstentions? Any noes? Okay, that passes with all in favor. Number 3, have hate crimes to be accurately counted.
Make a motion.
Thank you. Second?
Second.
Any abstentions? Any noes? That one passes. Number 4, expand the Hawaii State LGBT Commission from 8 voting members to, and that there's 2 of them here, 9 or 11. So we can vote on both. But
I make a motion that we expand to 11.
I'll second.
Second. Anyone abstaining? Any noes?
No.
Noted. Rick has voted no. All those in favor? Aye. Okay, the other 7 have voted yes. So that passes. Okay, and then number 5, banning gender assignment surgery on infants. Do I have a motion?
You mean, if a child is born intersex?
Correct.
Yeah.
Okay, yeah, I vote ban on that, or I make a motion.
Do I have a second?
Second.
Any abstentions? Any noes? That passes as well. We're making Philip work really fast and hard here. Sorry, Philip. Number 6, amending the surrogacy laws. So queer and straight couples do not have to adopt their own children.
Make a motion.
Move it. Second.
Thank you. Any abstentions? Any noes? That passes. Number 7, establishing emergency low barrier shelters.
Make a motion.
Second.
Joe seconds. Any abstentions? Any noes? That passes. All in favor. Number 8, a complete review of the Hawaii Revised Statutes to go to gender neutral language.
I move we make this a resolution.
A second.
Anyone abstaining? Any noes? That passes as a resolution. Okay. Establishing an education requirement for teaching our LGBTQIA+ history.
Make a motion.
In a second.
I'll second it.
There was a talk about resolution, there's talk about legislation, and there's talking about BOE. Is it to do all 3? Is that your motion?
Oh, that's a good point.
Well, I thought we were just doing a resolution, correct?
You're right. Yeah.
Well, no, but this is our legislative priority, so.
Right.
But I just want to make sure we're clear on what it is. Are we gonna do all 3 or do 2?
Well, if we can do all 3, that's fine. But I think the legislature itself has to do a resolution, correct?
I think Dean has some valuable input.
Yeah.
Dean, yes.
I think proposing a resolution is the right way to go at this
Yeah.
time. We're really not ready for legislation. We don't, wouldn't even know what to propose exactly, but a resolution is ready to go. So that would
Okay,
be.
so I'll go back to my original motion for the resolution.
I'll second.
Anyone abstaining? Any noes? Okay, that passes for resolution. And finally, number 10, ensuring that our community has access to mental health care on all islands.
So moved.
Yes.
Second.
I'm sorry, who seconded?
Joe. Any abstentions? Any noes?
1 abstention.
Rick is abstaining. Okay, and everyone who is for that? Yes? The other 7? Okay.
Yeah.
That one passes. All right, now we need to vote on who is going to take the lead on each of these. And I think that we should be clear that taking the lead may involve actually, reaching out to legislators and writing bills and all of the things. This is not a small ask, right? And in a short time frame.
I move that we make Michael volunteering to take the lead on 1, 4, 8, and 10.
1, 4, 8, and 10. I'd like to take the lead on 9, if that's okay with everyone.
Do we have to vote on this? Or
Yeah, we're gonna vote.
Yeah.
if
I can do 2.
Wait.
We'll go through one by one. I'm just taking notes real quick and then we'll make it clear. Shanda, what were you saying?
2. I can do 2.
Okay. We still need covered hate crimes under number 3, banning gender assignment surgery, amending surrogacy laws, and shelters.
I can do shelter number 7.
I'll take 3.
Who just said that?
Sandy.
Sandy, 3. I still need gender assignment surgery and amending surrogacy laws.
That's the easiest one. You just gotta advocate for supporting the task force, parentage task force reporting. So just give that to me.
Which number? Sorry, 6?
The parentage task force number 6.
Okay, and then we're just down to banning gender assignment surgery.
I have a comment, and I'm sure this is out of place. However, I am 100% opposed to forced surgeries on intersex individuals at birth. And at the same time, I wonder if, given the current political climate, it might be confusing to legislators if on one hand we're saying we should do gender affirming surgery, and on the other hand, we should not force babies into gender assignment surgery. I think that might be confusing. So if we don't choose a legislative lead and or we vote on this, maybe this could be wait
Well,
for
we've
another.
already made it a legislative priority, so it does, and if you want to take the lead, if you want to think you can thread that needle. Because this is going to be a heavy lift. It doesn't mean there's going to be a bill issued this, by making this a legislative priority doesn't mean there necessarily may be a bill this time. There, just so everybody knows, it takes the average life of a bill is 7 years from infancy to graduation at the big square building, where democratic values go to die. I'm sorry. I'm not that jaded. Yes, I am. So just that we make these priorities doesn't mean we're gonna get everything we want, and it may turn into a resolution, a task force, as those of us that have been dealing with this for many, many years.
Okay, in that case, I will be happy to take the lead.
Thank you, Shanda. All right, we're going to go through these and vote and make sure that we have all this clear. And poor Philip, we've been racing through this. All right, number 1 goes to Michael. Anyone who abstains? Any noes? Oh, do I have to propose that? Do we have to have a motion for it? We do. Who would like to move that number 1 goes to Michael?
I'll make a move.
And second?
I'll second it.
Abstentions? Noes? Okay, it goes to Michael, number 1. Number 2, that is Shanda. Who moves for that?
I'll make a motion.
Second.
Okay.
Who seconded, please?
Michael.
Thank you.
Blah.
Any abstentions on that one? Any noes? Okay, number 2 to Shanda.
Yes.
Number 3. Can I have a motion that this goes to Sandy?
I motion.
So moved. Second.
Rick seconded. Any abstentions? Noes? Okay, Sandy has number 3. Number 4, motion for that to go to Michael?
Make a motion.
Second?
Second.
Okay, any abstentions? Any noes? Passes. Goes to Michael. Number 5, motion for that to go to Shanda.
I'll make a motion.
Seconded. Michael.
Any abstentions? Noes? Okay, goes to Michael.
Can I interrupt you real quick? And it would be awesome if you'd say your name, because I'm trying to write.
Oh, sorry. Yeah, I will.
No. If you do that, it'll be much easier. Thank you.
We're like, this is the crash. Like, we're just throwing you right in there, Philip. Right on the wall. Like, how fast can you go? We're testing. Okay.
That would just help immensely. Then I don't have to keep doing that.
Number 6, who moves to give this one to Michael?
Sandy.
Thank you.
Do I have a second?
Joe.
Any abstentions? Any noes? Number 6 goes to Michael. Okay, number 7, do I have a motion that this goes to Rick?
Sandy.
Second,
Michael.
any abstentions? Any noes? Number 7 goes to Michael. Number 8,
No,
do I
Rick.
have?
No, go for Rick.
Oh, I'm sorry. Goes to Rick.
Seven goes to Rick. Yeah.
Rick, I'm so sorry. Just so we're clear in the
Okay.
notes, number 7 just went to Rick. Oh boy. It's Pauhana after this, folks. All right, number 8. Can I have a motion that number 8 goes to Michael?
Sandy.
Second,
Joe.
abstentions? Noes? Okay, that goes to Michael, number 8. Excellent. Okay, and then number 9, can I have a motion that this goes to me?
I make a motion,
Michael.
Sandy.
Michael, seconds.
Thank you.
Any abstentions? Any noes? Okay, I've got number 9. And finally, number 10. Do I have a motion that this one goes to Michael?
Sandy.
Joe.
Abstentions? Noes? That one goes to Michael. Thank you all. We just got done with the old business. And thank you, Philip. Jeez, I think we owe him a couple glasses.
Right.
All right. Now we're going to vote on, or I can ask for public testimony if there's any on these. Oh, I guess we kind of already did, but sponsoring the harm reduction conference. So we're to, oh, you know what? Before we get to this, I'm just going to have to ask that we vote to put one more thing in the agenda that wasn't in here before, because like I said, things keep coming up. So Michael put in the board packet about how he and I met with the national group of other LGBTQ plus commissioners. So there is actually a conference coming up in just like the second week or first week of December. I absolutely cannot do it. I'm in the middle of going into finals and all the grading and all the things. There is just no way. And I just got back. But Michael is willing to go if it's something that we will consider putting in our budget. So I would like to, first of all, amend the agenda, vote to amend the agenda to discuss this and vote on this. I move to do so.
Make a second.
I'll second. Okay.
Okay, any abstentions?
Right, Chair, you need to take some public testimony before you going into
Amend the
voting.
agenda? Oh, I'm just amending the agenda right now, just to talk about it.
Right. Even that, you'd have to ask for public testimony.
Public testimony on amending the agenda? Okay. Any abstentions? Any noes? Okay, let's talk about it. So Michael looked into this. It's probably going to be around $2,000. So I'm not entirely sure, and maybe Shanda can pitch in here about where we're at with our, I know nobody's actually been reimbursed for anything yet, but do we have a rough idea of where we are at with our budget to begin this discussion?
I think we have about 10, I'm sorry, I'm unprepared for this, but I think we have about 10 or 1,000 unassigned money. So I think this is definitely within our budgetary options if we so choose.
Okay.
We had 20,000, was that right? And for what period of time? Forever or
The fiscal year,
1 year.
July to
okay,
July.
and the fiscal year is,
July to July.
thank you.
Rick?
Well, I'm just wondering, can anyone else also apply to go, or only one person?
I don't know that we could afford more than one, to be honest. We could definitely vote on who goes. Yeah.
And what is this conference for? Or sorry, I'm not following.
Oh yeah, no problem. I know you put something in here, Michael, about it, but
It's item number 1 under Roman numeral 2.
yeah. Oh, there. You
It's
brought
the
up-
International LGBTQ plus Leaders Conference. It's put on by the LGBTQ Victory Institute. It's an arm of the Victory Fund. This is their educational arm versus the Victory. For those of you who don't know, Victory Fund goes out there and recruits, trains, and gets queer people elected. This is leaders that have been elected, LGBTQ leaders in different areas, and there are like Representative Tam will be going to for the state of Hawaii this year for sure. For the legislative side, this is like Kat said, when we met with the other queer commissions, they are all planning on sending at least one person, if not more, but they also have larger budgets and larger things. So they're also on the continent. So it's a 3-day conference. Yeah, and the travel costs are at $2,000. What you add per diem, we're looking at $2,500 with everything inclusive. Airfare, hotel, and registration, and the registration's $250, hotel's $750. I would be staying at a friend's house Wednesday night because to help cut down on the costs. Thursday night, whatever the day is before, because you can. Just so everybody knows, when you're traveling to the continent, they allow you 1-day travel thing. So I would use that. I would be staying at a friend's house that one night before the conference starts to cut down on costs, and then coming back on the 8th of December. This is LGBTQIA leaders from across the state and across the world. And this will also have a opportunity to network with other commissioners and commission staff.
Very last minute, like we literally just got invited to it, like literally last week, like.
Yeah.
Are we discussing this? Can I talk?
Yeah, please.
Okay, just want to make sure. I think this is a good idea for Michael to go. And the reason I say that is it's a good idea that we start networking with other LGBT leaders throughout the country, especially because, as I keep saying, there's going to be not a lot of information trickling out, and any kind of networks that we can form to be able to gain access to information would be very beneficial to us.
I echo that.
I agree. I think it's absolutely within our mandate. So I think it's great.
And I think that, certainly there'll be more of these in the future, right? Yearly. So we don't have to send the same person every time. But Michael was in that meeting with me and did hear all the preliminary discussions. And yeah. Anyone else? All right. I know this is very last minute, but I move that. Oh, any public testimony? I move that we send Michael to this conference and that we pay for it through our budget.
A second.
Any abstentions?
Yeah.
Rick is abstaining. Any noes? Okay, it is so passed. And Michael, you can work with Kristen on all of this still.
Yeah.
Okay. Next, real quick here, State Harm Reduction Conference sponsorship, any public testimony? Okay, so there's the opportunity to sponsor for 1,000 or for 500. Do I have a movement to do either one of those?
I move that we sponsor for at the silver level.
Silver level is 500. Do I have a second?
Second.
Quick question about that.
Yes.
I know that Andrew said that would give us an opportunity to have a table present. Is someone on the commission able to actually attend that and be the representation for that? Okay.
I can. And anybody else wants to join me, but I can. I put it on my calendar.
I may be able to.
And I even have a parking spot on campus.
Kalhana there after the conference. So.
Right? Okay, so do I have, let's see, I got the second. Okay. Anyone abstaining? Silver, 500?
I'm going to recuse myself since I am on the advisory, I am on the planning committee.
I'm abstaining.
Sandy and Michael are abstaining. Any noes? All those in favor? 1, 2, 3, 4. That works, right? 5. Great.
Wait,
okay,
5 and pardon me, 5 and 2 is 7.
1,
6.
counting on 6. Sorry, 6.
Okay,
Gotta cut myself.
I think, I don't know now, but yes.
And 2 abstentions, so that passes silver at 500. And who's taking care of filling that out or getting that to whoever?
I'll work with Kristen.
You will, Michael?
Yes.
There's double Michaels now. This is funny. I don't know where to look.
Yeah.
Okay.
And something to point out, I just noticed that it includes 2 conference tickets. I already bought my ticket, so
I already bought mine.
should have people decide if anybody wants those.
Oh, I didn't buy mine yet. Anybody else?
But we can address that.
I'm interested in going. I just gotta, check a couple things, but I can let you know in a couple days. Or I can email everyone and let you know.
And I'm comped in because of my work with them.
I won't use the ticket if somebody else needs it, but we can work that out. Okay, Zoom chat, keeping the Zoom chat as part of the public record. So the discussion around that, I don't know, my only trepidation there is that some of the things are like exchanging emails and whatnot. And do you really want that out in public? That would be my question. I'm happy to save the chat for Philip for his notes and everything, but I don't know about who wants it to be part of public record.
I'd like to make the motion. I move that we keep the Zoom chat with blocking out any personal contact information before it is saved. Before it is posted.
Okay, if I send it to you, you know how to do that, Michael?
I can redact anything.
Okay, Joe seconded it. Any abstentions?
Public testimony first, Madam Chair.
Oh, public testimony. Sorry.
Oh.
Okay, abstentions?
I abstain.
Shanda is abstaining. Any no's? Okay, then that passes with 7. Okay, next one I really wanted to get to, there was a link in your board packet. We got a letter from the National Governors Association about the Thriving Youth Mental Health and Well-Being. Okay, so just go to that real quick here. I'm wondering who might be interested in taking this on. Did you all have a chance to read it? Let me go to it.
I did read it.
You did?
I did.
Oh, shoot. Okay, so it'd be nice if we had someone in the mental health field, I'm sure, to be doing this. I have been on an NGA. Go ahead.
I can do it.
Rick, did you read the letter? You know what it's including?
Yeah. Yeah, I could. I mean, again, basically it's saying, can you be part of a group that's doing the work, right?
Mm-hmm.
Yeah, I can do that.
And do you have a schedule that's flexible enough that they'll probably set like at least monthly meetings?
Yes, now I do.
Okay, was there anybody else who was interested or is that? And thank you for sharing the screen, Michael. You're doing that faster than I can.
Is that going to be here in Hawaii?
Online, most likely.
Yeah.
I'm waiting for my new glasses any day this week, so I'm kind of like straining to read that. Everything to me is so tiny.
All right, then can I have a motion for Rick to be public testimony? Any public testimony?
Before you do that,
yes.
Is it okay? Again, they're asking for input. Is it okay if and this might be an Aaron question? Is it okay if I survey my colleagues to make sure? I mean, I can just provide the information that I know and what I know from mental health and from what I've done in the field, but is it okay if I collaborate? Are people available if I wanted to ask questions of different members? Is that okay?
Well, just as long as you understand you're asking in your capacity as a board member, because that's how you've been invited in your capacity as a board
Okay.
member.
Okay, thank you.
Okay. Any public testimony? Okay. If there's no one else that is interested, then let's vote. Do I have a motion for Rick to be assigned to this NGA association?
Make a motion, Sandy.
Michael seconds.
Any abstentions? Okay, that passes. Rick, it's all yours. I'll get you in contact with those folks. I'll get you that letter.
Thanks.
Let's see. And we've got 2 more on here, but we're already at 4:40, folks. I don't know.
Madam Chair, just real briefly on the floor.
Yeah.
I encourage everybody to read what's there. There's going to be this is going to be a long undertaking on this one. It's like it's like the ConAm. I encourage everybody that wants to be part of this or help make this happen is to review the Honolulu Charter, because we're going to do this in one fell swoop. Go through and hit everything all at once and see how many questions it requires on the thing. So this was more of a, make sure you're all aware of this. This is something that needs to happen. And just so everybody understands, this stemmed out of the Liquor Commission piece. When the Liquor Commissions is still in the process of changing their administrative rules to make sure sexual orientation and gender identity are covered under their non-discrimination policy. And so that we hit it there. So, and that's how I became aware of this. I think that and then we can, if there's any public testimony on that, then we can look at making this a priority for those of us on Oahu. And also talk about at a future meeting about the need for a Honolulu City and County LGBTQ+ commission, because they have a women's commission, they have a youth commission at the county levels and across all the counties, not just Honolulu, but also all the other counties. Because since we become a commission, there's been a lot more interest in how to become a commissioner. So, especially after this election.
Sounds good. Okay, and then number 5, preparing the required report. Who would like to prepare the required report? We've got to have someone assigned to writing the draft for review at the December meeting, which is next month. And I do not have time.
That's not showing up on my board packet.
It's not in the board packet. It's on the agenda. There was nothing to add to the board packet.
Okay, thank you. I'm like, I don't know what we're talking about.
So do we have a template? Do we know what kind of time commitment or how long this is going to be, or do we have anything?
I will, you know what, since you're all sending me to DC, I will take this on.
Oh, yay.
If you're gonna get more than your pound of flesh out of me. So yeah.
That's
if everybody's okay with it, I will have a draft ready for the next meeting, and we should have it vote on the with any amendments or requests. So I know I keep on saying this, and given some of the questions that happened today, read your agendas, read your board packets. Because there were questions that were asked today that were already answered by the board packets or your agenda. So that we all come prepared, because we're gonna have to hit the ground running on this one, to make sure, because usually the reports are due to the legislature 28 days prior to the legislature, so we will have very little time after our December meeting to make any amendments and changes that are gonna have to be done, and in abstention of everybody else, that whatever you all say. So working with Kat and I will work together on the final draft to get that out, to get that to the governor's office as well as the legislators.
That'll be my holiday break. Okay, thank you, Michael, for volunteering to do that. Yeah, and that would be it, folks. So next meeting is December 16th. I will get the Zoom link right. Maybe there'll be some miracle and we'll have a secretary by then, who knows? Thank you all very much for staying over. I really appreciate it. I'm so sorry. It was just so many things. Very grateful for all of you. And we are
Moved,
adjourning
adjourned.
4:45. Thank you.
Move to adjourn.
Thank you.
Bye,
Have a
everyone.
Aloha.
Can I say
Hello?
something?